Fifth installment of our journal club. So this is the final installment, and we're going to be dealing with an important article. This article is important for a lot of reasons. Those reasons may have to do with your understanding of what's called hip impingement, but it hopefully is also important to show you that there are physios or trainers all around the globe that have worked together to become very focused on agreeing on what we should do in order to be sure we're arriving on the right diagnosis and calling the same thing. We're comparing apples to apples when we say a player or a patient has impingement of the hip. This is extremely important, and some commentary that will maybe help bring this to life for you is that at the International Society for Hip Arthroscopy, we were faced with a crisis, a global crisis of access to treatment for patients and athletes suffering from impingement syndrome, while government payers and insurance companies have to make decisions on policy levels who gets coverage for treatment and who doesn't. There are many, many studies underway, including large studies, to see which treatments are better. But what we want to introduce this group to is the concept that indeed we all agree, at least finally, on what to call hip impingement when we study it, and how do we at least initiate the basic treatment pathways so that patients can have access to care. And you're going to see that we are authorship sharing on this. So you'll see my name on there. You'll see Dr. Hal Martin from Baylor on there. You'll see John O'Donnell from Australia on there. Michael Dienst from Munich, Germany there. You're going to see Rob Roy Martin from Pittsburgh. Mark Philippon from Vail. Keelan Nseki, a therapist out of Pittsburgh. You're going to see Tony Andrade from the UK. You're going to see Mark Safran from Stanford. And you're going to see our incredible colleague, Dr. Ryan McGovern, who's helped organize this course, as well as Mario Bezzini, Dave Kohlreiser from Ohio, Tim Tyler from New Jersey. We're seeing a lot of excellent people involved getting this out to you. So remember, as you conclude our journal club, that you can go claim your CEUs if you're a certified athletic trainer. I really hope that reading these articles and hearing some color commentary about them has directed your learning and maybe inspired you to participate in some more future learning, either with us, with the Arthroscopy Association of North America, with the American Orthopedic Society for Sports Medicine, or with the National Athletic and Training Association, or your local societies.